what we need to do is reduce the cost of health care. And that's not easy. Okay, I'm not saying there's going to be an easy answer to that. I chair the Senate Health and Welfare Committee. I work on legislation this winter with both of my colleagues on either side of me here today. What we put in place, very briefly, was legislation which is asking for experts who have helped design systems in other parts of the world to come back to us with 3 different design options. Come back to us next January. A new governor, a new legislature, with options that talk about how we can provide universal access. That means every single Vermonter with health care that they can afford and trying to reduce our costs. And we see systems around the world that have health care outcomes every bit as good as ours at 60 or 70% of the cost. If they're smart enough to figure it out, we should be too. So those design options, one of which shall be a single payer system, one of which shall be a public option similar to what's talked about in Washington, and one of which could be who knows what, because we're asking some smart people to help us figure this out. Put some detailed designs on so we can have a concrete discussion rather than the abstract discussions that we've had in recent years. Let's find a way to get rid of those administrative costs, the unnecessary testing, the types of things that doctors wish they didn't have to do. Let's talk about ask doctors to talk about how they're practicing medicine, which is not something you really want your legislators to do. But let's figure out what we can do to control the cost of healthcare. It is driving us into bankruptcy. $9 billion spent on healthcare last year, or $5 million, I'm sorry, $5 billion last year, estimated to be $6 billion from 2012. $1 billion increase, that's more than we collect in sales taxes, rooms and meal taxes, and income taxes in the state of Vermont to get a sense of the impact on this state. I believe we took an important step forward with this legislation this year, and if we can get 3 good ideas for the legislature to debate next year, I believe we can take some action on this, and that we can again show that Vermonters want to control their own future, and we can show the rest of the country a better way. Federal legislation can do some good for a lot of Americans, it can do some good for Vermonters, but it didn't get at the cost side of the equation in a serious way, and that's what we've got to do here in Vermont.